Hello, everybody. My name is Dr. Patricia Coughlin. I'm a clinical psychologist specializing in intensive short-term dynamic psychotherapy. I'm going to be offering a full-day webinar on Monday, May 1st, in collaboration with Yuval Elon in Israel. This webinar will focus on the importance of gathering clinical data in such a way that it can be integrated and incorporated into a comprehensive case formulation. It's this kind of detailed case formulation that should be guiding your treatment efforts. So the first half of the day, I will be showing a case in which we will be doing this process. So in ISTDP, in the trial therapy, we begin with a detailed phenomenological inquiry in order to understand the presenting complaints, the nature, history, and severity of the symptoms and difficulties the patient's experiencing. And then we're going to begin to get specific data on timeline and triggers to these symptoms and difficulties. So again, we can begin to formulate our hypothesis about the underlying conflicts that are responsible for their difficulties. So far, this sounds kind of typical, right? This is hopefully what any decent therapist would do. But we also want to very systematically be assessing the patient's capacity to do the work. You could have 3 patients with nearly identical presenting complaints and symptoms, and yet they have 3 different, ego structures, right? One could be neurotic, one might be character disordered, and the other quite fragile. And so it is only by assessing the patient's capacity and capacities, like the ability to introspect, to look inside, to have an internal focus, to connect with feelings, to recognize defenses, to regulate anxiety. What's their capacity to relate in a direct and healthy way with you? Or do they erect significant barriers to engagement? There are many facets of the patient's functioning that we want to assess in this initial contact. And when we put all this information together, again, we're going to be able to form a case formulation that will guide our intervention and treatment. All too often, therapists sit down with a new patient and they just do what they like to do. Whether it's CBT, ISTDP, they start to intervene straight away before they've really assessed the patient's problems and their capacity, and before they've really gotten in agreement with the patient on the nature of the problems, the goals to be achieved, and most importantly, the therapeutic task, what you and the patient are going to do together in the hopes of resolving their difficulties and helping them achieve their goals. So I hope you will join us on May 1st. As I say in the beginning, first half of the webinar, I'm going to be showing a case, and it's an interesting case of someone with quite severe history of trauma and yet very good capacity. So we often make the mistake of making some direct causational line between the patient's current functioning and their past trauma, but research suggests no such direct relationship exists. So hopefully we can blow that myth up. And then in the afternoon, we're going to invite 3 participants to share some video of a trial therapy so that together we can go through this process of assessing the patient's problems and capacities and integrating this material into a coherent case formulation. If you have an interest in participating, we have 2 slots still open, so please contact me. I'm going to have the link both to the registration and also to my email address so that you can contact me directly if you would like to be included and to participate in this upcoming seminar. So I hope to see you on May 1st. Thanks. Bye-bye.